Alright, hey guys, so my name's Mercedes Wheeler. I recently finished nursing school and I passed the NCLEX in 75 questions. The most stressful time of my life. Hitting that 75 question, like that 75 question popped up and I answered it and I clicked that submit button and I closed my eyes because I was so afraid, and then it shut off. And that's the only time I've ever been like, well, maybe I needed more questions. Maybe I should have answered more questions. But the reason that I'm on here is because I want to share with you what my secret was for doing that. Like what I know without a doubt, like helped me pass the NCLEX. Like not only what helped me pass the NCLEX, but what I know is going to make me a good, competent nurse, like delivering like evidence-based practice, like best care. And to me, like my secret, like what worked for me is NRSNG. The founder is John Hawes, and I found it and I actually like just kind of played with it. I didn't really maximize it, but once I realized what all it could do for me and how it catered to what I needed and so many other people, I couldn't quit telling people about it. And so people, like I tutor people and they'll ask me like, do you work for them? Like, no, I don't work for them. I'm not getting paid to do this. Like, I actually paid money to use it. You know, like I paid $49 a month for 9 months for this NCLEX resource. But you know what? I didn't need Kaplan. I didn't need Hearst. I didn't need other resources. Like that's the resource that worked for me. That the most effective resource for me was NRSNG. It had the SimCLEX, simulated NCLEX. It had NCLEX questions. It had all these things, and it had audio and case studies and patho sheets and like videos where like they write on the screen and like teach you specific lessons. Like they have entire courses, cardiac and fundamentals and test taking tips, and I mean maternity, peds. Like they have all these different courses that are everything that you need, that they think that you need to know to be a good nurse, to be a safe nurse, and to pass the NCLEX. And there are people that have taken the NCLEX for 6 different times and they are passing. They are using this resource and they are passing. And the only reason I'm telling you this is because I want you to go from where I was. I was a discouraged, stressed, cried every single week nursing student to someone who's motivated and passionate and had time. Like I had time to actually live my life because I didn't need to study for 12 hours in a row just reading papers. I would watch these videos and I would do this and it would just click. Everything would make sense. It was just so much easier. Everything is condensed in these lessons, everything that you need, where you don't have to read 15 pages from a book. I didn't have to. After I used it, I did not open a textbook at all, unless there was an assignment from it, obviously. But like other than that, like I didn't read from it. All the studying that I did came from NRSNG. So if I can take one person and get them from that disgruntled place to this happy, excited to learn place where you're ready and motivated and you love to learn and this passion for nursing, then that is all I want. That is all I want for you guys. So all I'm saying is give it a shot, try it. And if you don't like it, that's okay. There are other resources, but at least try it, because if you don't change anything, nothing will change. If you don't change your unhappiness in nursing school, then it's going to get worse because it's only going to get more difficult with the content. So anyway, if y'all have any questions, just reach out to me because I just recently graduated. I'm fixing to start my first job. So I hope y'all all the best, and I know that you can pass the NCLEX because I did, and because thousands of others are using this resource and it is changing their lives for them. They're pursuing their passion. Anyway, I hope you guys all the best.